I'm Dr. Tonie McKenzie, a resident physician here in New York City. A couple of colleagues and myself have gotten together with the LIT Network to answer your questions about COVID-19. Let's get started. So, one of the questions that you all asked was, once you recover from COVID-19, do you have immunity? Now, we're not quite sure. One study of 23 patients who had COVID-19 showed that they did have antibodies in their blood towards COVID. Another study that's actually in progress right now is using patients' plasma, patients who recovered from COVID-19, to treat current COVID patients. We're not sure the results of that study yet, and we don't really know if the antibodies in the blood is helping people stay immune from getting infected again. So the jury is still out. So what happens if you get coronavirus while pregnant? Here's Dr. Hollisa Rosa, an OBGYN right here in New York, to help answer that question.
Hey Tony, that's a great question. Thus far, with the available information, we have not noticed an increased risk for COVID-19 infection in pregnant women compared to non-pregnant women, which means that pregnant women have a similar risk for contracting COVID-19 as non-pregnant women. However, pregnant women are at increased risk for severe illness if they contract COVID-19, so it's important to remember to wash your hands and maintain spatial distancing. In addition, I think it's important to note that breastfeeding is not contraindicated with COVID-19, meaning you can breastfeed if you're COVID-19 positive. What you need to do is remember to wear a mask, avoid coughing near the baby, and wash your hands before and after. We got this, y'all. We'll be okay.
Here's another question for you. Should I take Tylenol or acetaminophen to treat my COVID symptoms, or should I take Advil or ibuprofen to treat my COVID symptoms? Now that question came out of a couple reports of some people who took ibuprofen or NSAIDs, non-steroidal anti-inflammatories, and found worsening of their COVID symptoms after taking NSAIDs. Now notice, these are only a few people, so we really don't know if NSAIDs worsen COVID symptoms. So what we've been telling patients is, if you have a fever and you have COVID, go ahead and stick to the Tylenol for now. But if you do have an underlying condition and you need to use an NSAID such as ibuprofen, take the ibuprofen. These were just a few answers to the many questions that you asked. Check out the next video if you want to hear some more answers. And I'd like to thank the LIT Network for putting this video together. See you in the next one.